Welcome everyone to the CAP and PAA Townhall. We're glad you could all come and participate today with us. I'm Dr. Troy Jansen. I'm the Deputy Registrar and Complaints Director here at the college. We also have participating Judy Malone from the PAA and Dr. Richard Spelliscy. Dr. Malone and Dr. Spelliscy are glad to welcome you to this town hall and to help us all as we look at this important issue that we're all facing. Over to you guys.
Perhaps, Judy, before we start, I could do a brief land acknowledgement. I would like to begin by acknowledging that while we are situated in Treaty 6 territory, a traditional meeting ground and the home of many Indigenous peoples, including Cree, Saulteaux, Blackfoot, Métis, and Nakota Sioux, our nature of our work extends beyond this reach and into other traditional treaty lands across Alberta. We respect the treaties that were made on these treaties and recognize that not all First People have signed treaties. We acknowledge the harms and mistakes of the past, and we are dedicated to moving forward in partnership with Indigenous peoples in a spirit of reconciliation and collaboration.
Lovely. Thanks, Richard. We're really delighted for all of you who have joined us here today for this live presentation series. We have lots of questions, and we want to be able to take this opportunity to share some of our responses with you. All of our lives have been really just turned upside down since March 11th.
I think we lost Judy there for a second. Hopefully she'll be able to reconnect here. Richard, do you want to add something?
Sure. I'll just start by answering some generic questions. Like Judy, I would like to acknowledge that these are unprecedented times and that there is much learning going on in all fields, including the field of psychology. One of the questions we often get is CAP working or operating at this time? And CAP does continue to operate with a skeleton staff working behind closed doors. The remaining staff are working remotely or attend the office on a rotational basis to reduce the risk for spreading the virus, COVID-19. CAP values the health and safety of all staff and members. All college activities being performed, however, there may be some delays in responding and processing inquiries, and we kindly ask all members to show compassion and patience during these times. CAP has been able to pivot to a paperless environment for both efficiency and environmental purposes. All our processes are under review, but the COVID-19 has given us new energy in ensuring that we can respond to our members and the public effectively. All CAP committees will continue to function. However, we had to have some initial cancellations simply because it was a new world and the government was making decisions daily. The goal, however, is to ensure that CAP's chief functions are operating and that we can meet our public protection obligations without compromise. We are also attempting to ensure that members get adequate information that is science-based, timely, and of value to their practices. As such, CAP has been communicating on a weekly basis to members, and as I know the PAA has, and we are working collectively and collaboratively to ensure that those messages are consistent and provide a clear message to members. So I'd like to thank you for joining us today on behalf of all CAP staff, CAP Council, and we hope that you find this afternoon's presentation informative. Thank you, Troy.
Judy, I think I see you back on now, so I'll let you try again here.
Yeah, and really this is one of the issues we're all facing with this increased pressure on bandwidth. Because I don't actually know where I cut out, that's one of the fun parts of technology, but we are able to roll with the punches. I don't want to repeat much except to really reiterate what Richard has said, and we're going to try and answer as many of your questions as we can today. So we might as well get straight to those.
Excellent. Richard, would you like to lead us off with some of the questions that we had kindly emailed into our office prior to the town hall?
Thank you, Troy. And Troy is correct that we did receive a number of questions by email, and we kindly thank all of those who took the time to voice their questions and concerns to us. Judy and I will be sharing, responding to those questions, and Troy will be moderating to make sure that we address as many as we can in this next hour. The first question was, if a psychologist unknowingly has COVID-19 and passes along to the client, what would happen? That is certainly a good, interesting question. If a psychologist has been taking precautions, for example, hasn't traveled out of the country, is practicing appropriate social distancing in their office sessions, is following the Chief Medical Officer of Health sterilization procedures, and unwittingly passes those symptoms, of course, that person would not be subject to any kind of regulatory intervention from the college. However, once that psychologist starts to experience symptoms, they need to take appropriate steps, including contacting Alberta Health's COVID-19 helpline to get direction on whether those symptoms would suggest that they should self-isolate for a period of 14 days or more. The important factor, Jermaine, is that we are all to comply to the best of our ability with the public health order.
Great. Troy, what's the next question for us?
So another question that came for us is on best practices in dealing with these kinds of significant events. One person asked about what practices were found helpful in dealing with other crisis or disaster circumstances, such as the nuclear meltdown in Japan, tsunamis, or wildfires, in Fort McMurray, and what some of the learnings from those experiences are.
Great. Well, there's a couple of things I wanted to share. Rather than speaking to all of those, which probably is a very interesting dissertation if anyone's looking for a topic, a couple of things that come to mind. First, some of you will have attended PAA's webinars, first for the Disaster Response Network, and second, the Trauma Basics. And we had a fantastic guest speaker with us, Irene Zhao, who is a member. She's also in China right now providing services in relation to the pandemic and post-pandemic. So with her permission, I'm going to share 3 things from her. And the first are the issues she saw there right now in China: hypochondria, sleep problems, panic, anxiety, depression. Next is conflicts in relationship, couples, parent, child, family. And the third is grief, loss, and trauma. She also shared that interventions that seem to be really effective, the 2 most effective appeared to be normalization and stabilization. And that for her, the biggest challenges were lack of information or cues, especially trying to provide services in an online tech-based support platform, and facing her own fears, concerns, and anxiety. I've also gone to the literature. I've done quite an extensive literature review, and we are so lucky that there is fantastic psychological literature already specific to this pandemic. So I'm just going to hit some of the highlights because I think they are quite important. That first outbreak in China was found to have triggered a wide variety of psychological problems such as panic disorder, anxiety, and depression. COVID-19 had the greatest psychological impact on Chinese people who were quarantined, resulting in the development of new models of social psychological interventions. And such a large-scale infectious public health event put healthcare staff under intense physical and psychological pressure. If we move then over to Statistics Canada, we already know that COVID-19 has had a profound effect on the health, behavior, and social activities of Canadians. Stats Canada has found that Canadians are very or extremely anxious about their health, concerned about the health of others, and most have reported fears that COVID-19 will overload the healthcare system. Other key findings were increased concerns about possibilities of domestic violence and stress and anxiety resulting from physical distancing measures that are being followed by most Canadians. Emphasizing the severity of COVID-19 and the social psychological implications of pandemic-related behaviors may be of particular importance, especially as psychologists will have an essential role. COVID-19 poses a particular challenge to psychological resilience. Chinese survey participants reported moderate to severe psychological distress in the wake of the pandemic that were moderated when there was psychological interventions, especially for vulnerable groups. And further around the world, many psychologists have stopped seeing clients in person while acknowledging that the demand for mental health care is expected to rise dramatically. This has resulted in an abrupt increase in the use of telepsychology, online or telephone-based, often before professions or practitioners were fully prepared to deliver services in that manner. And researchers are projecting right now that telepsychology is likely to continue to have high rates of use even after the pandemic.
And Troy, if I could just add to what Judy has said, is that the American Psychological Association in March did publish an article on 7 crucial research findings that can help people deal with COVID-19. Certainly, I would like to echo Judy's comments that a recent study indicated that 70% of people recently surveyed believe that the COVID-19 pandemic has impacted their mental health in some way.
Excellent. So another series of questions have been raised for those that are at the provisional state of their licensure and have asked questions on what impact, if any, this might have on their plans to write the ETriple P exam. So I put this question to Richard first.
Thank you, Troy. What is really important, if you're a provisional psychologist and you have yet to write the ETriple P, that ASPPB has an update on their website. The last update that I'm familiar with is for early April. And that indicates that if you were scheduled to take the ETriple P between April 16th and April 30th, 2020, your exam has been moved 30 days and you have been assigned to a temporary placeholder test center. However, you must log in or call and choose a new date and location. ASPPB, because of their system, cannot extend you past your 90-day test taking window. However, if you are going to extend it, you can cancel your exam, get a refund, wait 24 hours, and then reschedule. It's my understanding that ASPPB is going to be flexible. So if you do encounter any problems with ASPPB, please let the college know and we can make some inquiries to see if we can be of some assistance. But your first point of contact would be the ASPPB website. Thank you, Troy.
Another question that was raised by several were in regards to the Disaster Response Network, or DRN, that PAA has kindly put together. And I wonder if, Judy, you could address any questions that arose regarding that.
Yeah, so this is a recovery model program. So it's really limited. There's only 1 to 3 sessions. It is with high priority only for healthcare provider or first responders and then other Albertans. It's not meant to be a crisis service or to replace psychological services that people may still want to access. It's not for assessment and diagnosis, although it certainly might screen that. We are, just tremendously impressed that we've had a couple hundred volunteers in the province come forward. And that's done great things. It's caught the ear of the media. It's gotten great favor. Personally, I've had communication with several physicians and residents that haven't even accessed the program, but have said thank you, and they so appreciate it, and how can they work more closely with psychology. One of the better examples that I won't belabor, of course, Dr. Spelliscy can speak to this, but he's in contact with the minister's office, who's very interested, and then he puts them in contact with us, where we talk about the service, always with that fantastic twist to say, how can we talk now about access, funding, and the value of psychology, which we really are the best trained providers. And right now there's a need for psychological treatment diagnosis research, not just those crisis and service level supports.
Excellent. Thank you, Judy. The next question, there's been a lot of requests for clarification regarding the categorization of psychological services as either essential or non-essential and some of the directives. And so I'm going to put this question first to Richard to see if we can add a little bit of clarity for those that are listening on that categorization.
Thank you, Troy. Just prior to answer that very crucial and important question, which many people have, I just wanted to follow up on that ETriple P question for a minute, just to let you know that the college will, when it can, be flexible as well with those ETriple P deadlines. But I encourage people to, during this period, if they have to reschedule their exam, continue to think about writing their exam at the earliest opportunity. One of the really positive things about this whole pandemic is that we realized the value of having placed our oral examination online, and that many jurisdictions across Canada who we are in constant contact due to the pandemic have indicated some degree of uncertainty how they're going to address their jurisprudence and their examination, because they have a oral component to it, and people are either unable or unwilling to meet. So I think one of the positive outcomes in the past year has been that transition of that LEAP exam onto an online format, and that can be accessed without impediment. To go to the essential, non-essential services definitions, these can be found in the Chief Medical Officer of Health's March 20th, 2020 order, and it's online, and we included it in our communications, where it defines what are essential services and non-essential services. From the college's perspective, mental health is an essential service. So we did seek clarification on more than one occasion, and we also have had our lawyers write the government in a formal fashion to get clarity so that practitioners can practice with confidence. As it stands today, psychological services are essential. However, they described ones that will not result in an individual's life, health, or safety being immediately endangered as being non-essential. However, they did indicate that a non-essential service could be performed if it was urgent. And those can be things, I think, like a workers' compensation assessment where a person is not receiving any benefits. Not performing that assessment may put that individual and that individual's family in a high degree of stress. There is some urgency. Or an assessment for a child for a hospital placement. Again, that could be urgent, or a program deadline or funding. So each member will have to identify, is there a sense of urgency for those services? If they determine that that service is considered critical to the person's health and basic societal functioning, public safety, or preserving life, they can continue to provide that services. Again, they must look at all the requirements of the public health order, including pre-screening clients before they come to your office for recent travel or symptoms, having appropriate sanitization procedures in the waiting room, ensuring that if you have a group practice, that there is appropriate social space in the waiting room, and ensuring that common areas are clean between clients and those kinds of things. So as our guidance is, as close as possible, follow that order using your best judgment and, of course, your diligence.
Thank you, Richard. There's a number of comments, Judy, that your microphone is coming either loud or soft for some in a variable way. So if you might want to turn your microphone up. But this next question is for you, and that is, given that the current pandemic situation, psychologists are now providing more online sessions, and they're wondering if there's any recommendations through PAA regarding fees for this type of service, or if there's any advice to give there.
Great question. Yeah, PA does have a recommended fee schedule for people who didn't know that, and we haven't changed it for telepsychology. Indeed, you know, a lot of our practitioners will be facing additional costs. We've got technology costs, the cost of really determining what is the best fit for your clients and those that you serve right now. We're going to have increased costs in training, consultation, software, records management, etc. So we don't see any reason to have a different fee schedule. We're facing an unprecedented public health crisis that has particular impacts on psychological health. For psychologists in this province, your training, expertise, compassion, and wisdom are now more important than ever as we face this pandemic as a community. We're very grateful for people who are able to practice.
Well, if I could just follow up on Judy's question. Well, the setting of the fee schedule is certainly under Judy's purview. It's important to note that the research strongly suggests over the past 2 decades that virtual counseling services are as effective as face-to-face. So I think that if one is attempting to explain to the public why is their service virtually the same as it is in an office, it's for the reasons Judy just stated, but it also is the same professional service with the same degree of effectiveness.
Thank you both, Richard and Judy. There's also a question that's come up around whether there's any discussions around whether therapy by psychologists could become an insured service was one question. And I know that there was a recent announcement of funding through the government. I don't know who would like to address this first. Perhaps Richard, you could lead off, and then Judy, if that's okay.
Certainly. Well, as many as you know, Dr. Carrie Mothershill, the college president, and I wrote the Minister of Health a short time ago, indicating the need for mental health services and access, specifically because of the pandemic, but also because of the social isolation. Our experience with the wildfires and the great work that PAA did subsequent to that shows us those needs increase, and that there is a real benefit to the public to have accessible psychological services. So we did write that, and we had several discussions subsequent, and there was the announcement yesterday of the $52 million of additional monies going to the already existing $140 million mental health budget. However, we would like to see more than just enhancing existing programs that already have a high demand. And we have written a second letter that will be going to the Premier either today or tomorrow. I haven't checked to see if it's ready to go, from Dr. Mothershill and I, that elaborates that, well, that was a good first step, that access is still the primary impediment to individuals being able to secure the right service at the right time by the right professional. And so we still believe, from the college perspective, that it is in the public interest to have timely, accessible services by regulated health professionals, especially psychologists.
Yeah, and if I just add to that, of course, as people who are entrenched in evidence-based practice, we know that those crisis services, those frontline services are invaluable, but they're not everything. And if anything, we create a revolving door where more and more of those frontline kind of services are required, because we're not actually able to assess, diagnose, and treat the more complex needs, or provide access to those Albertans who really have the highest number of social determinants of health considerations. And so they need access. The right people need access to the right providers at the right time, and psychologists are the best trained. We were delighted to hear from the Associates Health Associate Minister's Office. We provided them with lots of information, difficulty following up. We're grateful for the college always opening that door. We never leave it just there. We are in discussions with some health trusts, with the Canadian Red Cross, and we will just continue to work on our advocacy plan. The psychologists, we all know this, that better funding for better services is what's going to make the real difference.
Thank you for both of you for that. Another key question that is arising, and actually just for those who are listening live, I am keeping track of any chat comments, and we're going to leave some time at the end if we can try to address any of those. But the next question that's coming up is how psychologists might adjust in practice to that if their primary area of practice is psychological testing. There may be those that are wondering about available resources or adjustments and advice that we may give in terms of adjustment to practice that are primarily assessment-oriented practice or formal testing practices.
Perhaps I'll address that question, Troy. Certainly, that was my area of practice, and I can really appreciate how that presents some additional challenges for psychologists. Many neuropsychologists in hospital settings or in community settings are attempting to meet challenging times and doing interactive assessments. A number of individuals have identified procedures. The American Psychological Association has published an excellent article on how to adjust test batteries and how to conduct assessments during this time. And I would encourage people to consult that resource. And I would encourage people in general. The American Psychological Association, I think Judy would agree, has done a stellar job in providing information. We've had several webinars, including on Good Friday. I attended a webinar across North America about how we can improve our practices and adjust to the COVID-19 environment. But certainly you can do things like adjust your testing assessment batteries, doing pre-screening again, doing interviews maybe over the phone or virtually, and then just coming together briefly to conduct the assessments. I know practitioners are ensuring that their clients are sterilizing their hands before they manipulate objects and sterilizing the objects after they've been manipulated. So there are adjustments, practical adjustments individuals can take. And I think that if they simply use a good judgment and diligence, there are ways to address most, if not all, assessment tasks. But again, if one does the best job they can, identifies clearly the limitations of their evaluation, indicating that it's an estimate, it did not comply with the standardized test procedures, and that follow-up testing may be warranted when the pandemic restrictions have been limited. I think that as long as those are clearly identified, the assessor has met their professional obligations.
I don't know, Judy, did you have anything to add to any resources that you've come across that you'd wanted to recommend?
Well, really, mostly to reiterate what Richard has said. And so I live in this world of information and clarity and advocacy, and we're all inundated. That is why at PA, we have a website where we're trying to list those core resources. We're going to them all the time. We know when our anxiety levels are high, we don't find what we want. So going to those reliable sources is really, really worthwhile. The American Psychological Association, some of those individuals and their legal and their practice groups they often work 15-hour days, particularly at the beginning. These are well put together resources that have been very carefully thought through in an extremely short period of time. So take advantage of them. It really makes our practices easier.
And one thing I wanted to follow up on, Judy, was that they're offering many of those resources for free. So if you aren't a member of the American Psychological Association, you can you can access information, and you can also attend some of their training webinars free of cost. So don't let that be a barrier to you to explore those resources.
Excellent. I also would suggest that there are some guidance around the country from different colleges, including BC College, for example, had an excellent guide on tele-assessment services. It's a checklist-oriented thing. I think APA, as you mentioned. So those are some things you could look for. Some of the testing companies I know are being consulted with on creative solutions in this time, and so I'd say if you're in that area of practice, keep apprised of that, because it's going to change quickly, and it's good to be nimble in this kind of time to kind of address that. So thank you for that. I do have another question that I'm going to start to you, Judy, is in this kind of time frame, this is not only stressful for everybody that we're servicing, but it's stressful for us as professionals. And so in the name of self-care, what are some of the things you would be recommending to our members to sort of take care of themselves as they adjust in this kind of time?
Yeah, and you know what? We are so grateful to both be essential healthcare providers, but also to be able to provide telepsychology. There's a downside to that, is that we're not just at home and unable to work, such as our colleagues dentists who can only work in emergencies right now. And so that puts that additional layer of pressure on us that we need to be aware of. So if we're looking at balance, there's a few sides. There's the self-care, but there's also that professional care, becoming as aware as you can, attending this YouTube session today and trying to learn more about practice during a pandemic, or more about telepsychology or the testing online that was mentioned. Those are excellent ways to keep us more involved and aware, that decreases our own anxiety. But we also have to do self-care. We cannot be all to everyone, and we know that demand for services is going to increase. So this is a very relevant question, very important question. It's also an issue because some people are very new to working from home or to providing telepsychology. So there are great tips that, minimize your distractions, set goals and boundaries. We're good at relaying psychological evidence. We know how to apply it to ourselves, and we should be doing that as well. Having clear communication plans for clients, for colleagues, peers, supervisors, students, research participants, and of course, seeking social connection. I think we really flubbed a bit as a society and as cultures when we started off calling it social distancing. It was never social distancing, it was physical distancing. And so we have to really underscore that we want to increase our social connections. It's the physical distance that we want to really put in place. And of course, teamwork. I've never been prouder of psychologists who have come together. Connecting with your peers, with your colleagues, is not only essential for self-care, but it's just a really great way to get through this and garner some resiliency and strength. The rest that I could go through, like exercise and managing your anxiety, we know. We can go to the psychological literature, and we've got some of the best fact sheets and tip sheets on how to do that. We just can't forget ourselves.
If I could just add on to what Judy has said, this week our CAP monitor will go out and its focus is on self-care. So I think it's very timely, and I would encourage people to have a look at that and to read and examine areas where we can express gratitude, such as what Judy suggested, with the fact that we could transition or pivot much of our practices to a virtual platform where some other professions aren't as fortunate.
Thank you. The next round of questions is really regarding guidelines around general use of social media. And I think that a lot of our members are seeking guidance on a variety of the uses of social media in business-oriented practices, and wondering what kind of cautions we'd have for them or certain advice on that front. So maybe we'll start, Richard, if you have an initial comment on that, and then Judy, if you have anything you'd like to add after that.
Thank you, Troy. Yes, so of course, I would direct members to CAP's professional communications guideline. And I think that's an important guideline. One of the issues for those pivoting to virtual media platforms is that many have not used it for their practice purposes. And it does require some adjustments, and as Judy aptly noted, some boundary setting, because many times when people are working from home, there's lots of disruptions. Also too, where the your virtual platform is located, whether you have a laptop in your office or in some other room in your home, that needs to be taken into account. But because of course there's additional confidentiality concerns, not just with what type of technology you're using, but where you are located and where your client is located. Are they in a private space? Are they able to receive the information quietly? Are you sensitive to the fact, are there other people in the room with them and those kinds of things? And Troy is correct. The BC guidelines are very helpful in identifying what those cautions are. There are additional boundary setting that must be taken. So for example, if you're using a platform that you indicate to the client when you will be responding to messages, when the appointment is, it's no different than a physical appointment. They're required to be there on time as you are, those kinds of things. So setting those boundaries early. We've had questions about social media, about liking, making those kinds of things on a person's Facebook. Confidentiality is just exponentially more complex when you are delivering from a virtual platform, to ensure that all steps are being taken so that the client's information is protected. So we would suggest that messaging, blogging, those kinds of things, they do require a lot of thoughtful consultation with colleagues and with your either association or college to ensure that the practices you're taking don't inadvertently cross an ethical or professional standard. So again, it is a time for heightened professional awareness, even though you might be in your comfortable home setting and have a lot of personal distractions. It is particularly important to ensure that your client's information, your record management is appropriate and complies with all expectations. Thank you, Troy.
Yeah, all I would really add to that is that our technology and professional practice task force did amazing work and provided a really good basic report, part of which was the chair and task force saying, wow, we have only touched the tip of the iceberg. And so we've now officially formed the Technology and Practice Committee because these issues are going to continue to increase. And boundaries are important. And when we're public, we're a person, but we're a psychologist. And there's really important clarity around that we can do in very thoughtful kinds of ways.
Excellent. Thank you for those pieces. And I'm dutifully chatting, and sorry if I'm looking down while I am listening, but I'm also trying to record all the commentary and questions that are coming in online. The next question, bank of questions, is related to supervision changes that may occur as a result of COVID. There's a number of questions regarding what flexibility, if any, there will be around hours, manner of supervision, or other registration requirements. So I'll put this question first to you, Richard.
Yes, well, certainly provisionals, it's even an additional stressful time. If this is a situation where they are learning quickly and fast, hopefully that their supervisor will be a support to them and helping them guide through these complex times. So regarding the supervision of activities, yes, you are a provisional, so you continue to need to be supervised. One question spoke to about signing up for a new position or a helpline. Those should all be in discussion with your supervisor. If you were, prior to becoming a provisional or registered psychologist, if you were signing up for a helpline, that would simply be a volunteer activity. But because that's in the scope of the profession, you are now guided by the Code of Ethics and Standards of Practice, as well as the practice guidelines. That doesn't preclude you from offering your services pro bono, either to PAA through their disaster response network, or some other crisis line. But again, you must ensure that you are complying with your standards. We have received a number of questions about either practicum placements being shortened or internships being shortened because of that. We will judge those each case on an individual basis. If you were in a practicum and you received credit for that, the college would recognize those credits for that practicum. If you were in an internship and your internship was supported, I can say today that for sure you'll get credit for the hours you have completed. The issue is the balance of those hours, and those will be looked at as an individual basis. But certainly you will not lose out on the work you've done towards completing your registration requirements to date. Another question we received, Troy, in advance was the issue of, do volunteer pro bono hours count towards my required 1,600 hours? Yes, and that's one of the reasons why they need to be supervised, acknowledged, and approved by your supervisor. If you are doing them outside the area that was approved, you need to send in an amendment to your supervision plan to the college, and you still require that your supervisor has competency in that area. But yes, the college wants to recognize any work done, ideally will be credited. So hopefully that answers many of those questions regarding supervisions and internships. And again, people can contact the college, especially in this time of the pandemic. It's best to do that in email, and someone will get back to you. But we recognize that those are stressful and important questions for you. Thank you, Troy.
If I just add a little bit for professionals, be involved in your community. We are a large group of psychologists. We give each other support, consultation all the time. Expand your networks. This is the time to be really developing those. PAA, you have a provisionally registered psychologist as a dedicated board member. She runs all kinds of great services and support and really fosters those communities of practice. So connect with Heather, connect with your peers. A lot of you are struggling with the same kind of issues at the same time right now.
Thank you. I think one question in the supervision area, if I can just keep on that topic for 1 second longer, is whether there's allowance for face-to-face supervision requirement to be done by distance, and whether telehealth services, if interns or provisionals are shifting to telehealth as a delivery, counts as direct. Can you address that specifically, Richard?
Yes, and that's one of the things we did quite quickly when individuals were pivoting towards telehealth. Yes, during the pandemic, you can Skype or use another medium to have technology serve as the face-to-face medium. And so that's certainly, you can get credit for the Skype. The supervision requirements remain the same. You still need to have the same amount, but the Skype, the face-to-face portion, another secure kind of format, either business Skype or other forms of DoxyMe or TheraLink or those kinds of things can be utilized. Again, paying attention to the security and confidentiality of the information that you're discussing.
Thank you. So the next set of questions that we've had come in quite a bit, and actually I've observed are coming in as well by chat, are adjustments and realities around provision of services through telehealth delivery, and some of the pitfalls, considerations of certain types of populations that we may be servicing. For example, how do we adjust to trauma or other vulnerable populations? Some have already been suggesting some excellent resources online, as I've noticed, which is excellent. But Judy, if you wouldn't mind leading off on this one and just sort of talking about some of the initial resources that you believe are available for members to be aware of sort of the trips and traps of some of the offering of telehealth, some of the things that they may need to adjust when in comparison to doing in-person services.
And it is a great question, and it's very close to home for me because in 21 years in practice, I've always worked with particularly vulnerable populations. And we have a balancing act right now. There are risks inherent in seeing people in person. We have groups and clients for whom distance services are going to have their own kind of set of barriers. One of the things I did want to share is that you need to know the Canadian Psychological Association and all us other members of CPAP, or basically it's every every psychology association in Canada, have come together and are doing a lot of advocacy specific to service provision. And one example is telephone services, because for some people online is not an option and they're not going to have the privacy, and so it needs to be by telephone. But third-party providers and some insurers were a lot slower at adopting that. It was actually impressed and maybe a little bit surprised that Indigenous Services Canada was one of the first to publicly say we will pay for telephone sessions. We have to think that we have clients and groups that don't have internet service, or if they do have the ability to access services privately, they may not have broadband speed. We've got older adults, those with disability, people in rural, northern areas, low income. And so finding those tools for how we can adapt our practices to consider all client groups we work with are important, but never more important than for psychology, because these are some of our more vulnerable groups, again, that are going to have greater impacts of stress, trauma, adding to everything else and increasing their psychological risks. There are great resources out there. I'm happy to hear that there's some sharing on chat already. Take up those extra training, look into those extra resources. They're going to help us to start to bridge some of that.
And I would just like to add to what Judy has said, and I agree with everything she said on this point. The issue here again is that the psychologist can determine if it is urgent and critical that they service these vulnerable populations. And in case we're thinking of addictions, individuals who are chronically ill, other populations that where virtual means don't are not accessible to them, that certainly they would look at how can they adapt their face-to-face services in a manner that meets the expectations of the Chief Medical Officer of Health.
Thank you, both of you. I have a related question to this that's been prompted by this COVID-19 situation, is that many clients may have relocated back to maybe a new jurisdiction or a province, or there may be increasing demand through EAP providers to provide services across jurisdictional boundaries. And so I'll address this question to you, Richard, in terms of what are the guidance and what changes have been made, if any, in terms of offering telehealth services across jurisdictional boundaries.
Yes, again, this is one of the topics that we've discussed both nationally and across North America on these changes. And as most of you know, that psychology services are guided by either state or provincial regulatory bodies. Myself, it's no secret to many. I believe that psychologists should have the access or the ability to follow clients to other jurisdictions. And I believe that that would only strengthen, not endanger the profession if it's done with appropriate regulatory supports. What has happened is now the provinces are in general agreement that if you are seeing an existing client, but that client has had to leave the province because of COVID-related circumstances. So for example, if you are working for student services at one of the universities and that student program was terminated early and they returned to their province, most provinces would say that fits within those parameters. However, each province is somewhat different. The rules for people coming into Alberta are posted on our COVID dedicated webpage, but you would I encourage everyone to check with each jurisdiction where their clients are going to be relocated because of COVID-19. Again, the basic parameters are you must have an existing relationship with that patient or client. And secondly, that you will not be taking on new clients from that jurisdiction. And again, you must follow their specific rules, such as notifying the regulatory body, and you will see our rules on that webpage. And most of the jurisdictions have signed on to the same rules that we have posted on our webpage.
Thank you, Richard. The next question is really, I think, directed more towards yourself first, Judy, and that's a number of people have asked about, are there any sort of support or volunteer to frontline workers? And I think this is related to your disaster response network initiative, but maybe you could speak a little bit about both what's available to public, but is there any sort of supports available also to psychologists themselves? And how may they access those or contribute to those if they're willing to support that with PAA support? And one of the specific suggestions that had come on the online chat was around, get the language right, online practice mentors. So people that are experienced in offering telehealth services, are there any of those that might be willing to volunteer to be an online practice mentor for those that are self-admitted Luddites in the technology sphere, much like myself, who are still learning how to use this technology well? So if you could comment on that first, Judy, and then Richard after that.
I like how Troy bundles about 8 questions into one. That was very impressive. All the things we do, perhaps at no fee, becomes lumped into the volunteer stuff. So I'm going to try and touch on a few of them. Probably will forget some, and then Richard will clean that up after whatever I forget. With the Disaster Response Network, I did want to say a couple things that I'm quite proud of that I do know are very taxing for our association. So there's been a couple volunteer psychology initiatives where psychologists' names and contact informations are public. They're put on a web page as volunteers, or they're provided to the public. We don't do that. We have staff by email and phone screening those referrals for appropriateness, and we contact the psychologist, who then reaches out to that first responder, health professional, or member of the public. Because if we don't protect our members, we run greater risks for them. And it's just really, really important to us when we talk about seeking volunteers or volunteer services. Those are the people we have to really take good care of. We have compiled a list, and we really encourage people that if we've missed anything, send it to us on our COVID-19 dedicated webpage. At the bottom, it's online and crisis supports, and there's probably already 15 or 20 of those. So again, as psychologists, we offer specialized kinds of services. There's a range out there, and we are trying to keep track of them as a one-stop shop that you can go to. Of course, as psychologists, we're people, and we may want to or need access to some of those for sure. And we do have that ability to access them. It's a little tricky because, you know what, if I want to access service, I want a psychologist. I know most of them. So we have a lot of the same kind of issues around boundaries and clarity and how we get and keep our own self-care. I'm fortunate to have many very good friends that I know I can go to and will really provide me with some good support. PA does have practice advisors for PA members, of course, that can consult. Whether or not they necessarily have expertise in telepsychology, no, not at this time. One of our practice advisor certainly has expertise in social media, and so has begun to do consultations in that regard. But this has been evolving very, very quickly, and we certainly want recommendations. When you're doing peer consultation, when you're reaching out to your supervisors and your communities of support, you're going to start to identify some of those people, which will be excellent, and we need to know about those resources too.
And I would just like to follow up on what Judy said, and I really think that the issue of finding a mentor for helping them navigate through technology is an excellent idea. I'm going to encourage Judy and I to do some workshops in the future on this very topic. If you recall, I think it was 2 years ago, we discussed telehealth at the Professional Development Day. And the same person who presented is the one who's done the webinar that's free right now that APA has on telehealth resources. And I encourage people to check that video. But it is time well spent. It is a good investment to reach out into new technology. certainly, the ability to offer this service will expand the psychologist's reach, and it'll also allow some versatility and flexibility for the practitioner. So I think that although many have pivoted to technology quite quickly, I think that it is here to stay, and I can only see a brighter future for it in our practices. And if we do it well, we'll continue to be seen as leaders in telehealth services.
Thank you for that. So we're getting close to the end of our 1 hour that we had allotted for this. And there are a few comments that I'll just note to both of you to see if you'd like to address any of those. And we may not have time to address all of the questions that have come in. We will be trying to do that in a variety of different ways subsequent to this. But I'd also like to invite you to provide any concluding comments, if you will, after this, after I put these last few comments to you. The last two things that have kind of come up relate to the ability of our psychologists, if they are finding either a complete or a majority of their practice being reduced due to COVID. And a lot of them are having concerns around their abilities to access the financial resources of the Canadian Revenue Association and the federal government, or other programs that may be available, and they're wondering how successful people are being. And so I'm seeing a lot of chatting about that. So maybe if you have ideas where they can look for information on that. But also some have asked the question of whether people have been successful with business interruption insurance. And I believe, Judy, you've had a conversation with one of the major insurers around that question. So those are the two themes that have come up. And other than that, there's been some really excellent comments. I really appreciate all the commentary that has come in over this time frame. And I'll leave it to either of you to decide who would like to go first on that. Judy, would you like to lead off?
Sure, I'll just hit a couple of highlights quickly. So one of those is that people may not know, but in the background, CPA, the Canadian Psychological Association, together with most of the provinces, have been working on really a clear information statement and request to the federal government. We're just putting some final touches on that today. In addition, today we had a meeting with BMS Liability Insurance. Most insurance liability insurance for professionals is going up. It's having unprecedented impacts from the pandemic at this time. It's interesting that we actually had quite a few members that had purchased business continuity insurance specifically, and those people do have access to some coverage that's really not available to many health professionals, including many health professionals that have been impacted. Of course, not everybody bought that. So it's going to be a matter of really exploring what options there are to you. Blanket statements are really tough right now. They are so tough because every psychologist has a different ability to continue to work or practice. They have different economic and financial impacts. We're really grateful for everyone who completed our survey. We're going to keep sending out our pandemic practice survey once a month. We want to understand how this is impacting people, and it's with information and facts that we can do better advocacy, and we can be more prepared to support people both as an association and for future impacts professionally, personally, what we see impacting our clients, etc. Richard, what would you add to that?
Yes, and I would just like to echo what Judy is mentioning about the insurance. And often when I do the final review of our members' files, I make sure that they have insurance for regulatory insurance in case there's a discipline issue or those kinds of things. I think now we might start looking at, do they have that business interruption insurance, and are they aware of that? However, we do have the insurer has agreed to write an article for our CAP monitor that's going to follow the one on self-care that I mentioned earlier in today's presentation. That CAP monitor will be dedicated to private practice issues, and I will speak to the insurer to see if they can specifically identify the special packages that Judy mentioned for continuity of service and for business disruption policies. And hopefully those can answer practitioners' questions to determine if that's something that would be of assistance to them. But they have agreed to contribute an article in our private practice issue, which will be coming shortly.
Did you ask us for some concluding comments, Troy?
Yeah, I think just in the last few minutes, if either of you have some sort of concluding comments or messages you'd like to send to those that are participating. I see we have, at one time we had as many as 498 of our people online with us, which is exciting to see the participation of our members who are looking for guidance in this area. And I do think that it's important. My last comment too is that I've seen comments around using our judgment, supporting one another, looking towards each other for learning and support. And I'd say that is appropriate in a circumstance like this. And that's my concluding comment. So I'll let each of you do your own concluding comments, and then I think we're ready to wrap up.
Okay, I'll go first. I actually wanted to give you a bit of our list of PA's priorities during this pandemic. And priority 1 is you, our members. The next priority is public education. There is incredible value in psychology, especially right now. There's our disaster response network, helping members pivot to telepsychology and those telepsychology resources, collaboration with our professional liability insurance provider, which is it's a self-regulated plan. Collaboration with our regulatory body. We are very fortunate in Alberta to have a good working relationship with our college, and really kudos to the College of Alberta Psychologists for that. We're working very closely with psychology organizations across North America, as I know our colleges as well, which is so important. We're not reinventing the wheel. We're able to do so much more in that way. And of course, advocacy, policymakers, funders to increase access and funding support for associations and for our members. PAA understands that the current situation is absolutely one of uncertainty, financially, professionally, for our families. Professional associations like ours cannot continue without membership, and we want you to know how invaluable that is, not just for your access to the liability insurance program, but because we are stronger as a community of practice and as Albertans because of that sort of collective benefit. Your clients and Albertans need you now more than ever, and that will only increase. And in these challenging and unsettling times, we want to thank each and every one of you.
And once again, I'll echo Judy's comments. First of all, I would like to thank her for the high degree of collaboration that she's shown to work with us and to communicate regularly. Judy and I talk several times a week, and informing the government as well as other organizations of issues facing you. We'd like to thank the membership for being engaged in this first ever provincial town hall meeting. And I'm sure that we would, based upon the number who've attended, consider doing this again in the future if there are many outstanding questions. Council's goal and the college staff's goal is to continue our engagement with members, to let them know that we are listening, we are considering their viewpoints. We are meeting on this coming Saturday, and we are looking at mechanisms that will streamline our processes, that we can continue to meet our obligations and assist those in the regulatory registration process to join the profession as quickly, as efficiently as possible, because we know their services are needed, and that we continue to adapt and learn. And we see this as a promising challenge that we think that working with our association, our members, that we can overcome together. So thank you again for joining us, and thank you, Judy.
Thanks, everyone. And we are signing off now. If anyone has any additional questions that we didn't address today, we would all welcome those questions come directly to us. Thanks very much.